Hello, my name's Ashley. I'm going to be your student nurse today. Can you tell me your name and date of birth?
Khadija Newsom, 12/28/2002.
Perfect. And then before we get us started with anything, do you have any allergies that I should know of?
I'm just allergic to wasp venom.
What happens?
My throat closes up.
Okay. All right, I'm going to ask you a few questions first, and then we're going to go ahead and do a head-to-toe assessment. Do you know where you're at right now?
I'm at Bryan Stratton College.
All right, do you know what year it is?
2026.
And then what time of day is it?
It's daylight.
All right, patient seems to be alert and oriented, ×4. She looks properly groomed, appropriately dressed, no odors. Her face looks symmetrical. She's responding appropriately, and her mood seems neutral. All right, so I'm gonna do your vital signs right now, okay?
Okay.
I'm gonna start by taking your temperature. 98.2, so
Okay.
normal. I'm gonna put this on your finger to gauge your oxygen saturation. All right, it's at 99% on room air, so that's normal.
Okay.
All right, can I tap your wrist real quick? I'm gonna measure your pulse, okay?
Okay.
All right. So I counted about 90 beats per minute, which is
Okay.
within the normal range, and then I also counted your respirations, which were about 18. All right, I'm gonna take your blood pressure now.
How does that feel? Feels nice.
I heard 136 over about 62. And then I'm gonna just shine a light in your eyes just to make sure your pupils are nice and reactive. And just look at me. And then can you follow the pen with your eyes? Perfect. So you're tracking movement appropriately. Your eyes are full and reactive. Pupils are normal size. And the whites of your eyes look normal. Alright, so now we're going to do your neuro exam. So you are alert and oriented, you're answering questions properly. We discussed your pupils were reactive and responsive to light. So now, you don't wear any glasses, do you, or anything?
No.
Okay. So I am going to do your grip strength. Can you grab my fingers? Can you give them a squeeze? All right, nice and equal. I'm gonna push you, and you push me back, and then pull. We do the same thing with your feet up, and then down. Perfect. So equal strength. And now we're gonna do. I'm gonna have you smell some stuff, okay? And you're gonna tell me what it is, okay?
Okay.
Can you close your eyes for me?
Peppermint.
And then what's this one?
Lavender.
Perfect. Alright. I'm going to touch a part of your face with your eyes closed, and you're gonna tell me what I'm touching, okay?
Okay. Forehead, left cheek, right cheek, chin.
And then I'm also gonna touch you with something sharp and something dull.
Okay.
Your eyes closed, and you're gonna tell me what is what, okay?
Okay. Dull. Sharp. Sharp. Dull. Sharp. Dull.
Alright, so your cranial nerves. Pause it.
Okay.
Alright, can you move your head kind of like up and down, side to side, and then kind of just like roll your head a little bit. Can you shrug your shoulders, and then can you open your mouth and move your tongue around? And then can you say light, tight, dynamite? Or
Light, tight, dynamite.
Okay, perfect. Alright, and then one more question for that. Are you in any pain right now?
No, not right now.
Alright, so I'm going to palpate your head just to make sure there's no abnormalities like any lumps or any tenderness. Tell me if anything feels tender.
No.
No swollen lymph nodes. Tenderness. Your trachea is centered. Your mucosal membranes. Pull your eyes down a little bit. Nice and peak. I am now gonna feel for your pulses, okay? Can I see your wrists? Alright, they're nice and equal and strong and regular. I'm gonna feel for your carotid pulses, okay? Nice and strong. Nice and strong. I'm gonna listen to them as well. Perfect. Nice and loud. Alright, I'm gonna feel for some pulses on your chest, okay? I'm gonna feel for one down here. I'm also going to listen to those, okay? gonna check your capillary refill quick. Alright, nice and normal within 3 seconds. Okay, so you didn't have any tenderness in your neck and no vein distension present. So your cardiovascular seemed normal. Alright, so now we're gonna move on to the respiratory portion. So, like we discussed, your oxygen saturation was normal. You don't have any respiratory history like asthma.
I have asthma.
Do you use an inhaler?
Yes.
Okay, how regularly do you use it?
My asthma used to be like pretty uncontrolled, but it is like controlled now. So I'll just use my albuterol inhaler as needed.
Okay.
Like usually if it's like too humid outside, my chest becomes like really tight, so then I'll take it. But other than that, I don't really use it. I only use it if I really need to, and I do have a nebulizer as well. If the inhaler doesn't work, then I'll use my nebulizer.
Okay. Alright. So I'm gonna do some breath sounds real quick, okay? Make sure I don't hear any wheezing or anything. Take a deep breath. Perfect. Nice, clear bilateral lung sounds. Alright, so the next one, I'm just going to answer or ask a couple questions. They might feel a little bit awkward. Can you tell me when your last bowel movement was?
Like an hour ago.
Okay, and was it normal?
Yeah, it was like nice and solid.
Okay, I didn't have any like odors that are
No,
unnatural.
it smelled like what I ate, so.
Okay. Nice to know. Thank you. And then is your urine pretty normal? Is it yellow? Does it have any odors to it?
No.
It's not like cloudy or anything.
No.
Do you have to go frequently at all?
I go to the bathroom pretty often.
Okay. Does it burn at all?
No.
All right. And then what's your diet normally like?
I usually eat a lot of snacks, a lot of carbs, not really eat too many fruits and vegetables. Really got to get on that. I do eat a lot of meats, a lot of chicken, seafood, not as much.
Okay. Pretty normal.
Mhm.
Nothing too crazy.
No.
Okay. Alright, just the last couple questions. How do you normally get around at home?
I walk.
Alright, you don't use a cane or a wheelchair?
No.
Have you had any falls?
No.
Okay. I noticed you don't have any kind of limp or anything. Okay. And then the last questions. You don't have any open wounds on you at all?
No.
Okay. I noticed when I was feeling your pulses, your skin was nice and warm, and your skin color looks pretty normal for your ethnicity. Okay. Well, I think that sums up our head to toe.
Thank you.
Thank you.